Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Lindsay Seefeldt, a doctor of physical therapy who specializes in oncology rehab and lymphatic services. Lindsay is the owner of Uplifted Oncology Rehab in Green Bay, Wisconsin, and she brings a wealth of knowledge and expertise to her practice. She's a PORI-certified comprehensive oncology rehabilitation specialist, meaning she's specially trained to support cancer patients at any stage, whether they're newly diagnosed, going through treatment, or entering post-treatment survivorship. But that's not all. Lindsay is also a certified lymphedema therapist, helping those with lymphatic concerns and lymphedema find relief and regain their strength. We're so excited to have Lindsay on the podcast today to talk about how she's helping people heal and thrive after a cancer diagnosis, as well as what we can do now for cancer prevention. Let's dive in. Hey everyone, welcome back to our last episode with Dr. Lindsay. We're so excited to have you back, and this is going to be a great one. So we're going to be talking all about poop today, which is probably not always the topic you're expecting on a podcast, but hey, everybody poops. So we're going to be starting out talking about, obviously, a lot of common FAQs that come around this topic, but also things you can do about it if you don't feel like your digestive tract is functioning the way it should be optimally. So let's start out first with gut health is so important, and I think that's really becoming something that people are well aware of. But why? Why is gut health so impactful to our whole body as a being?
I believe all diseases start in the gut. And so our gut is a natural way to excrete. This is how we get the bad stuff out of our body. So we have to poop. We have to eliminate the toxins, eliminate the waste. Otherwise, it seeps in you. And then a lot of times, if it stays in you, it'll seep into your outer body too, and your body will pick it back up again. So we have to poop. Bottom line.
Mm-hmm. To flush the toxins.
You gotta flush the toxins.
Yeah. So let's get into kind of those common FAQs. How often should someone be pooping? And why is it a problem if you aren't?
Yeah. So ideally, we should be pooping every single day, if not multiple times a day. I mean, my older son is the best pooper in the world. He'll hate me if he hears that. But this kid, he'll eat a meal and then he immediately has to go and poop. And this kid has he never gets a cold. He never gets sick. And I really believe because he's such an amazing pooper, his body is naturally, awesomely excreting everything. And so God made us to excrete. We need to be pooping every single day.
So is once a day sufficient?
I think it depends on the person. I think multiple times would be better, but I think at minimum, we should be pooping at least once a day.
And I would assume the same answer would apply for kids.
Same as for kids. Yep.
Okay. What does a healthy poop actually look like?
Oh, I love this topic. So I use, it's called the Bristol scale. And if you Google it, if you just put in the Bristol scale, it'll actually pull up what the poop should look like. So there are seven different poops, I guess, that can come out. So the first one is considered constipation. So this is where you're pooping little lumps, it's little round little drops. Okay. The second one is similar, but it's more of a sausage shape, but it's lumpy. So these two, number 1 and number 2, are considered constipation. The next two, so 3 and 4, are ideal. So this is what we want our poop to look like. So either we want it to be like a sausage, and it's okay to have a little cracks in the top. So that's number 3. The fourth the fourth one is a sausage shape, but it's very smooth and soft. So those are ideal. 5, 6, and 7 are considered diarrhea. So 5 is kind of soft blobs. 6 is mushy stool, and 7 is complete water. So ideally, we want to kind of be about, like our poop should look like a sausage with little cracks or very smooth. But I mean, we all fluctuate between all of them. Like, sometimes we have a little watery stool. Sometimes we might have a little bit more constipation, but we ideally want to kind of be around that kind of sausage shaped cracks or smooth.
Just in your experience on this topic, what percentage of people, if you're just to pick a number, I know I'm not talking like sciencey, research-based, but like what percentage of people are actually pooping the way that they should be?
I don't know percentage, but I don't think good. I think you think about our American diet. I mean, just look at, and some of it's not our fault. It's just what we're exposed to. It's what's in the marketplace. And, I think we as a whole, Americans, we eat absolutely poorly, and we're not getting the correct amount of fiber. We're not getting, we're eating things that are toxic to our bodies. So, I really don't think a lot of us are having normal stools because of the diet we eat.
Do you feel like most people are constipated? Are they kind of more on that realm of things? If they're not pooping on a daily basis or multiple times a day, it's typically because of constipation?
Yeah, it's hard for me to tell for sure, but I know the clients that I tend to work with tend to be more on the constipated side. So I do feel, because I do feel like a majority of us are tending to be more on the constipated side than the watery side, but it definitely can go both ways.
So we've talked in our last episode a ton about the lymphatic system and drainage and how important that is to eliminate our toxins. So if you are constipated, that means that your poop is not flowing through your body as quickly as it could or should be. It's kind of getting bound up a little bit, which means that toxins are staying in your body longer than ideally. Can constipation kind of increase your risk for cancer?
Yeah, I think that's unfortunately, I think that's the fastest rising cancer out there is gastrointestinal type cancers. And I think either we're not excreting things like we should, or we're eating, poorly toxic foods. So yes, if that, I always talk about stagnicity. So if things are not moving or flowing like it should, that is staying still. And then when it's staying still, you're having that toxicity build up. You're not having that good flow, that good change. It's like a river. You think about a river versus a swamp. What's the difference between the two? The river is moving. The swamp is just stagnant. So we have to have things move, because if we have more toxicity that's staying stagnant, yes, it is increasing the likelihood that, you conducive to cancer. Like we're creating an environment conducive to cancer.
And what are some common signs that your gut health might be out of balance, other than like the poop look, right? So what other things might you be feeling?
I think most of us are probably pretty aware. Like a lot of times it's like, you just have that like pit in your stomach, or you don't feel well, or you eat something and it just doesn't agree with you. Just that bloaty feeling. Sometimes brain fog is another one, or sometimes it's like physically you look distended where your belly is fuller. So I think all of us can agree, like when our stomach is not working like it should, we can tell like, it doesn't feel good down there.
Or I mean, even like skin conditions, or like, gut health issues can come out in ways that we don't expect. I feel like too.
Yep. Rashes, acne, can be a sign that your gut health is not well.
Okay.
A lot of our listeners are mamas, and a lot of them have had things like C-sections. So this kind of makes me think about, how do abdominal scars like C-sections affect digestion, bowel movements, or do they at all?
Oh, hands down, yes. So this is definitely my expertise. So being a physical therapist by background, I've had training in what's called visceral mobilization. And so that's a term we're like, what does that mean? Visceral is just a fancy term for organs. So in our belly, our organs do a beautiful dance. Like they're moving, they're shifting, they're basically dancing. But when we're talking like external things like a C-section, scar tissue, there are so many people out there with all different kinds. I mean, I've heard of so many different surgeries, like whether it be gallbladder removal, appendectomy, which is your appendix removed, C-sections, hernia repairs, just there's so many different abdominal surgeries. All of those different surgeries create scar tissue. And when that scar tissue is not worked on, it can create a little like a stuck pull in our internal organs. And, if you're talking, C-section, for example, that's the lower abdomen. It's kind of right along the bikini line. It can kind of tug and pull down some of that lower intestinal tract. And so things might not flow as well down there, and you can get kind of stuck. And I have twins, and I had a C-section with them, and I've had to work on my own C-section because it was very stuck and very tight down there. And I really do believe that affected some of my bowel movements.
Have you been doing well with that?
Yeah. So I definitely have been working over the year, and it's amazing. Even, my twins are 7 now, even 7 years out, sometimes I can feel that incision down there.
Tug.
Like it's like a little tug every now and then. So when I feel that, I do my own self-releases, and I teach my clients as well, that come work with me to maintain it. So if you're ever feeling that stuck feeling, I teach my clients how to get things released and moving.
Yeah. And I would say if you have scar tissue anywhere, that's important, whether it's in your gut or anywhere else, it's important to really think about that scar massage and talk to somebody about that.
Yes.
Mm-hmm.
So if they're interested in this and they wanted to come and see you for visceral manipulation, or what did you call it?
Yep. It's a visceral mobilization.
Mobilization.
Yep.
Okay. What would they expect? What does that session actually look like?
It's so comfortable. It's such a, definitely assessment wise, I know each internal organ. So I know how each organ should feel, how it should move. So I literally go in organ by organ. So I'm feeling your liver. I'm jumping over to your stomach. I'm feeling your colons. I'm feeling your intestinal tract. I'm feeling your bladder. And so a lot of times, especially with like the scar tissue, and clients will actually feel that too. So as I'm working the organ, they'll like, oh, that feels really stuck. So they a lot of times can in turn feel their internal organs being stuck. And once I assess and know where we need to work, then I actually do techniques that I've been taught to help soften and move the internal organs. And you have no idea how many times I've had clients will text me later that day or the next morning, like, Lindsay, I had the biggest bowel movement of my life after you released my abdomen. So, this is life-changing for some people that they didn't even know their internal organs were stuck.
So this kind of looks like a massage on your belly.
Yes.
Okay. But it's obviously has a ton of intention. And I just find it so interesting. Like if I were to feel my belly right now, just to think about that, you can identify each organ.
Yeah.
Yep.
Yeah.
Yeah. With my training, so I was trained by the Burrell Institute. And so Jean-Pierre is the one who founded this. And, he really, he knew how to teach all of us practitioners how to palpate and feel the different organs. And I'm telling you, being a physical therapist, I've had anatomy, I've had all that kind of stuff. I worked on cadavers. And it's just so different when you're palpating and oh my gosh, I had no idea that your stomach went down that far. So my sense of anatomy completely changed when I had that training.
Wow. And that's so interesting. Now, can somebody do this in a form at home too? And you said that you'll train them on how to do it, but I guess I'm just thinking if someone is like, oh, I've been feeling constipated, maybe I should just try rubbing my stomach in a certain way. Is there a way that they should go about massaging their stomach area to help with this flow?
Yes. And that's definitely one thing I cover with them. So, as I identify maybe some of the restrictions, I'm teaching them different things that they can try at home to release and move it on their own. So yes. Yep. Okay. I'm training them.
I feel like this should be something that everyone could benefit from, whether you're constipated or having any issues, because we get stuck. Our bodies feel like that.
And it might not just be because of scar tissue, just think about, I've seen it with trauma. If anyone's been in a motor vehicle accident, even the impact of having that seatbelt, across your lower belly, that trauma when you're kind of getting catapulted forward can create an internal trauma too. So it's just amazing how that's connected. And then, not to mention there's a whole mind and body connection. So your brain, certain anxiety, stress, depression can internalize into a different organ. And so sometimes when we release the gut, we're releasing some emotional stress too.
Oh, yeah, I've heard that.
Yep. There's a connection between the two. So yeah, it doesn't necessarily have to be abdominal surgeries. It could be like a blunt trauma. It could be, some internal stress as well that could be holding in there.
Or just general stress. Like if you're feeling really stressed, this might be a really good ticket to feeling better.
But if you think about it, like when you're really stressed and nervous, like you get like those butterflies in your stomach, that's a thing. There's a mental connection between our brain and our gut.
I do want to circle back to constipation because I feel like this is so prevalent in today's age. So visceral manipulation is something that you can offer and help people with, but what are some other tips to just help constipation in general, whether it's diet, whether it's just things in their house that they can start to implement to hopefully help this without having to just like go take some Miralax?
Yes, right. I definitely, number one thing is, how is the water? Like, are you being hydrated? Because the fluid is what helps kind of drive and move things. So, I'll always like double check the water intake. Things that I do and things that I love to train my patients on. Number one is castor oil. I love topical castor oil. So if you've never heard of castor oil, it's a natural plant. It was used in the past. It's a natural laxative. So I don't recommend consuming it because you'll really, it'll really flush you out. But topically, if you put a little castor oil in your hand and then kind of rub it on your belly, or even some people put it in your belly button, it naturally sinks through your skin, your pores, and it'll sink into our gut and just naturally like help stimulate it.
Okay. One other thing that I'm curious on is fiber. So is fiber best for someone who has more loose stools and wants to help make them a little bit more bounded? Or is fiber still good for someone who's constipated, or does that actually slow them down more?
Well, you got to be careful. There's a balance, because I know sometimes people are like, oh, I got to eat all this fiber. But if there's too much fiber, like if you're eating too much fiber, it can actually bound you up. So, fiber does help naturally move the stool. So you got to have that right balance. But that's with everything. You've got to balance out the fruits, the vegetables, the proteins, and all that kind of stuff. So just having a diet of just 100% fiber actually can make you constipated.
So you mentioned hydration, you mentioned castor oil. Is there anything else that you have tips-wise on how to relieve constipation naturally?
Well, the self-massage type techniques, sometimes, even just getting your hands on your belly and just even doing like circular motions just to kind of naturally relieve it, that in turn sometimes will help stimulate that. In previous episode, I talked about a vibration plate. I've just standing on a vibration plate will jostle everything in your belly. A lot of times after the vibration plate, I have to have a bowel movement because it is literally catapulting. It's moving my stool as I'm standing on it. So that is a good way to...
I actually thought of that too. When we were talking here. I'm like, I think that vibration plate actually would be a really good idea. So I'm glad you brought that up.
Yep.
Another reason to get it.
What is it about coffee that makes us have to go to the bathroom? Is it the heat?
Honestly, I don't even know, but I definitely, that's one part in me. I drink coffee and that does get me moving. So I don't know if it's a certain thing I don't know if it's the heat or if there's a certain component. I don't know, but
and I drink
works.
decaf and it still makes me go. So it's not like a caffeine thing.
Yeah.
Okay. One other thing on this piece, because it's just so fascinating. And I think so many people are dealing with it. And I just want people to be able to walk away with different tools in their tool belt. I've also heard that if you're going to be massaging your stomach for constipation relief, you should almost be going, and I'm trying to think about which way this would be, but from your right side to your left side in that circular motion, so that, because that's kind of the way that your intestines tract. Is that correct?
Yep. So our large colon kind of, it just like you described, it starts kind of at the right side, comes up, across, and down. So the left side of your body is kind of the rectum. That's the descending colon. So you do want to go, if you like basically a clockwise direction. So if you got a clock on your belly, you want to go clockwise to help stimulate and move the stool in the correct way. Correct.
Now, if someone has been struggling with digestion issues for years, whether it's constipation, bloating, they just don't feel right in that area, what is their very first step that they should do?
Yeah, I definitely refer out. So I think we have so many amazing, in the Motherhood Alliance, so many great functional medicine providers that, can do a little bit of deeper diving, whether it's like a stool test. So a stool test is, they look at your stool, they can actually calculate, okay, like what is your microbiome like? What are the good and the bad in there. So I think seeking out a provider that really can, maybe dive in a little bit deeper into, how your stool is, is it a food sensitivity? So it's more of that internal thing. So definitely the first step, I think, is to seek out, a provider that maybe can do a little bit more in depth to your system.
Okay. This is fascinating.
Very fascinating.
This is applicable to everyone as well. Whether or not you think it applies to you. But to finish out our 4 episodes together, I would love to just hear, what does the future hold for Uplifted Oncology?
I definitely want to continue to grow my business, and I have a larger vision to have a facility where people know that they can go to for the oncology, for the lymphatic health, because there is nothing like this in our area. Like previous episodes that we had talked about, like there's just, people aren't aware, people don't know. So I really want to have a facility where people know that they can go for optimal care for their cancer and their lymphatic needs.
And just to clarify, if someone is looking for lymphatic help from you or this visceral assistance, they don't need to have cancer to see you for that.
No. Nope. I do a lot of preventative stuff. So, like we talked about, getting your system moving, getting the lymphatic system optimized. I do a lot with breast health as well. So, if we can stop cancer from happening,
absolutely,
come see me now. I'd rather see you then than during the journey. But if it happens, I will absolutely assist you through the journey as well.
Awesome.
Wow. Yeah.
And we talked about numerous free resources you have on your website. We also talked about in our first episode that you've linked arms with some other professionals in our area. You have a podcast called The Integrative Edge. So make sure you guys check that out. But you also do some community events. So if people would like to learn about events that you're doing actively in the community, what would be the best way for them to learn about them?
Definitely follow me on social media. So I Instagram, Facebook, I am posting different things that, we're doing as a community. So I love community events. So I'm doing multiple ones throughout the year.
Perfect. And what is your website again?
Uplifted Oncology Rehab.
Okay. And if you guys did not already listen to our prior episodes, we had one fully dedicated to breast health. We did talk about oncology rehab as well. So if you do know someone who is going through a cancer journey, that is definitely one to pass on to them. And then we also talked about the lymphatic system. So if you're just hopping into episode 4 here of this series, make sure you go back and listen to those 3 episodes. They were amazing. Mm-hmm. And this was such a great conversation. And we so appreciate you being here and just everything you're doing in our community.
Thank you.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.